Oh, hello. Thank you for joining me for this evening's webinar. My name is Dr. Pauline Green, and I'll be introducing you to the range of programmes that we have available in health and social care in the online learning department at the University of Derby. I will answer your questions at the end if that's okay, but please feel free to type away and ask any question that you want, and we will come back to it at the end of the webinar. So, today's webinar then will introduce you to the course content, what we teach and what you learn. I'll introduce you to the academic team fairly briefly, but just so that you're aware of some of the faces and the people that are within the health and social care team. And I'll give you an overview of what you can expect as an online learning student. So just a little bit about me, because you may be interested in knowing that I'm an academic lead, so I manage programmes and I have a team of people that I manage, and I'm academic lead for social work and social care. I'm a Doctor of Education. I'm also a social worker. I actually qualified in 1984, so don't work out how long ago that was, but some time ago, and I am currently registered with the Health and Social Care Professions Council. I've always liked education and teaching, and I'm a practice educator in social work as well as an academic within the university on these programmes. I'm also a committee member of the British Association of Social Workers, and coincidentally that's where I'm going after this webinar, so I'm going to one of their meetings. So this is the team. We have actually quite a number of other associate academics who teach on the modules, who have specialisms in certain areas. But what you can see there is Paula. Paula Shaw is the academic, my manager, the academic head of our department, and Vicky Cockerell, who specialises in counselling and nursing studies, Danielle Mills, who is she's a fractional lecturer who comes in and is part of our team, but will also specialise and teach in areas like counselling and psychotherapy and cognitive behavioural therapy. We've got Yasu there, who is a specialist in terms of counselling and psychology. Gemma Ryan, who leads the modules around research, that's her specialism and her main interests, and Lucy Hutchinson, who is education but is involved in some of the modules that we teach if there's an area around children and young people's education. So as you can see, we actually have quite a number of courses in health and social care, and I know that you're interested in different things, so I'm not going to dwell too much on any of these, but certainly if you do want more information, we have a lot of information on our website, but we would be able to talk it through with you as well, and contact you at another time. But just to make you aware, we do have a Masters in Integrative Health and Social Care, and as part of that, there are some students who like to study just for the year to get a postgraduate certificate. And so they just study certain modules, and we have a postgraduate certificate in dementia care, so all the modules are around dementia, and we have a postgraduate certificate of leadership and management in health and social care. So the modules focus on leadership and management, and that's what those students do. We also have the BSc, the degree, honours degree, and it's a top-up in integrative health and social care. And we have a certificate of credit, which is a program in its own right, but it's just one module, and it's a really good module for students to study if they intend to go on to the BSc, study at degree level, at that top-up level, but feel that they need to introduce themselves to academic study because they have been out of academia for some time. And we also have, for anybody who wants to specialise again in dementia care, a University Advanced Diploma, which is at level 6. So you might be wondering, what is it like to be an online student? You know, what can you expect? And I've tried to list there for you some of the things that you would expect to happen in your first term when you first start learning as an online learning student. So we are very keen to keep up and maintain communication with you, and you would have an online learning advisor that you could contact if there were any issues around accessing materials, maybe on Blackboard, on the platform. But there are other people that are there to support you as well. So you will have a module tutor, a module lead, and will be allocated a personal tutor as well. Your module tutor will be accessing the module at least 5 times a week. So they will be, you know, keeping track of how you're learning and how you're progressing, and maybe entering into some of the discussions on the discussion board, or looking at some of the things that maybe you want to talk about one-to-one in a personal blog. You can also expect 2 to 3 live sessions per module. So you may find then that round about week 2 or week 3, there's what we call a Blackboard Collaborate session, and you have the opportunity to join that session and receive assignment guidance, or maybe receive some further information about the module that you're studying or the particular unit that you're on that week. And maybe another session again about halfway through the unit, through the module, sorry, just to make sure that, you know, you're on track with that assessment, and, you know, if you need any more guidance, that would be given by the module tutor. And maybe then again, towards the end of the module, there would be another Collaborate session. And it's really nice to have that discussion with your tutor, but actually with your other peers as well, who hopefully would join that session too. Throughout the modules, there are lots of different, a whole range of learning activities, things that are going to help you to do that final, or what we call summative assessment. So, but things that you're going to find very interesting as well, hopefully. You know, some of them might be things that you've got to read, they might be articles, they may be quizzes. They can be all kinds of things that you will do as an activity that will develop your knowledge around that particular area that you're studying. There'll be discussion boards set up on the module so that you're able to, you know, answer questions that may be posed to you throughout the module, and you can discuss things with your peers. It's really good because you can learn from others. You feel that there are other people there in the same boat as you know, they're studying with you, and they will share their practice experiences and they'll ask questions, and it's really nice to have, to know that there's other people there, and that helps you as well as you progress through your studies. You may find that there's a formative activity, and in that formative activity in the module, it's there actually to help you with the summative assignment. So although some of the activities may be optional, we don't say that you've got to do every activity, although we do recommend that you do, but there will be one activity there that is a formative activity, and that's something that we really feel is going to be, you know, essential for you to undertake. You'll have a summative assignment, and they vary. So, you know, you may have a traditional kind of written style of assignment, which is essay style. You may be asked to produce a report, and you'll be given guidance about the structure for that. But you may do a presentation. You may undertake different things that, you know, you might be asked to maybe do a critique or a commentary on a research article, something like that. So there are different things there as summative assignments. And that's useful for you because your skill areas are going to be very different. So, you know, you may find you're very good at doing a presentation, or you're very good at doing, you know, an essay, but actually not so good at doing something else. And, you know, it'll give you the chance to practice and to improve those skills, but also to shine in areas that you feel that you're very good at. So you're going to study on these modules with a whole range of students. And that range of students will be in terms of age, culture, gender, but also, most importantly, your peers, the other students studying with you, will be in different practice areas. So you may find that somebody is a nurse, they may be a healthcare assistant, they may be a psychologist, and they may be in psychiatry, they may be a social worker. You know, there's a whole range of people doing all sorts of different things, and they will share that practice experience with you. So here's a taste, I suppose, of what the modules look like if you're studying. I'm going to do the BSc, and I'll show you what modules there are for this trimester in the MSc as well. So if you decide to study with us in trimester 2, in January, at the end of January, these are the modules that you would be able to choose from. Now, one of those modules you will see is a core module, preparing for research and evidence-based practice. So, you know, you might decide to do that core module. You may feel it's very useful for you to do that straight away, but you don't have to. You may choose from the other options. And as you can see, they are quite wide-ranging. So, for instance, you might want to study about ethics and legal issues. You may want to focus on dementia care. You may want to do something like the social landscape, which is around sociology, or working with vulnerable people, which is very much about safeguarding with children, young people and adults, or mentoring is another option for you. So quite a number of options. On the MSc, you will see there that there are 3 options that you can study at the end of January for trimester 2, and they focus on ethics, dementia care, and also in leadership in health and social care. So how you'll interact with tutors and other students, I've actually really talked through that a little bit with you in one of the previous slides. But I think the main thing to say to you is you're not studying alone. And I think that's really important to hold on to and remember when you're an online learning student. There's all sorts of ways that you're going to engage with other people, and people are going to engage with you. And that will be you know, from the online learning advisor through to the library, to the academic tutor, to the other students that are studying with you. So, and they'll do that via discussion boards. You will set up a personal blog, or what we call a personal journal sometimes. And what that means is that things that you want to share or ask with your module tutor can be kept fairly confidential. So there are some things that you're going to want to share with everybody. There are other things that you want as a more one-to-one. But there will be live sessions, as I've said, through Blackboard Collaborate. There'll be possibly a cafe forum, which gives you the chance to just talk to other students. So the academic, the module tutor, won't engage with that. It will just be your colleagues and peers. And of course, there's emails as well. We're very keen in each module, and actually in each unit, and you'll find that there's between 8 units that you'll study, and between 8 and 10 units. And in each unit there will be some reading, and anything that is cited or referenced in that unit will be there as part of a reading list. So there will be some recommended reading, there'll be some reading that we say is absolutely essential, you know, you have to do that reading, and there'll be other things that are very optional in terms of that wider reading. But we have a really good library service, and they are geared up to online learning, and they know what your needs are as an online learning student. So what you'll find on our reading lists and within modules is that for the majority, the material is available online through our library as an e-book or an e-journal. And you'll find that some of the sessions that the library team run will be very helpful for you as well. So we've reached the end of the webinar. It seemed to go very quickly, actually. So it will be great if any of you have got any questions. You know, I'm more than happy to answer them. And I don't know if any of you have been typing. You probably have as we've been going along. And I will answer those questions now. If you can think of anything else, please type now. Okay, has anybody got any questions? It may be that through talking through the slides and listening to this webinar, things have been answered for you, but is there anything that anybody would like to ask? No, I'm hoping that the session has been helpful to you, and of course, you know, it is recorded, so you know, it may be that you can, you know, look at this again, listen to this again, but certainly I would advise you, if you're interested in joining us this for trimester 2, you know, to put forward your application. Somebody is asking a question. Is it possible to change some of my modules that I've already chosen? And yes, actually, you still have time to do that. So don't worry, have a look at what those options are. It may be that things have changed for you in terms of your practice and, you know, what you're thinking about doing in your career. And you may decide actually that you'd like to study something else that's going to be more applicable for you. So no, it's absolutely fine. You do have time to change your options. Is there anything else? Okay, so if I just put the last slide on, just as a reminder really for you that we're starting very soon. It's quite exciting. We always like it when we're about to start a new trimester. So we start on Monday the 30th of January. Please submit an application if you haven't already done so that we can get you up and running and get you enrolled. And if you have applied and you have been accepted, welcome. You know, I'm really looking forward to having you as a student on the modules. So make sure that you contact us to enroll on the course, and payment will be taken at the point of enrolment. And thank you for attending the webinar. Just before I go, are there any more questions? Okay, I'll say goodbye to you then, and good evening. We got a question? Thank you. Thank you, Natalie. I hope that was helpful. Thank you for joining me.